It's a good idea.
I pull up the participants. Want to make Jenna a panelist. Jenna's from the Moss Center.
Oh, yeah. There he is.
All right, whenever you're ready.
Are we on?
Yep, we're on.
Okay. Good evening and welcome to the Opioid Settlement Funds Advisory Committee. It's Wednesday, July 23. It is 6 o'clock. We have, I guess, just about all of our members here again tonight, so I'm not going to take a formal roll because the ones that aren't here are up there on the screen. So welcome, everybody. We do have quite a bit of business to get through, so we're going to start with, I had asked the city manager if she could come back with a schedule of funds that have been received. And if we back into it that way, if we know how much we've got and what it looks like, it might help us with our next decision with our first project. So if you're ready with that, we'll start with you.
Sure. I am going to try to do something fancy.
Nope, just gonna share a
And
screen.
share. All right, can everyone who is on the computer see the screen sharing? Perfect. All right, so this is actually the link to, I believe it's the AG's website where this lives. So rather than reproduce the data, I thought we could go to the source. You'll see right here is the city of Bangor. And there's payments, the greenish gray is the total. And then these three blue lines underneath are how much was recouped from each of several categories of opioid manufacturers. So not really relevant to our conversation where the money came from. But you'll see that the city of Bangor in 2022 received $417,000 roughly. In 23, just shy of 85,000. And then in 2024, 577,000. So what that means is that we have over $1 million in the bank. The city did spend or has spent roughly $100,000 of this money on needle cleanup services, I believe. So still roughly $1 million in the bank.
Is that 100,000 been spent over those 3 years?
I didn't
Or all at
pull
once? It's okay.
I know it was first Heel and then I believe Wabanaki picked up those services.
Yep.
I don't know if it started back in 2022 or if it's been all more recent, but it's 100,000 in total,
Okay.
roughly. I
Yep.
mean. So then you can sort of go down to the later years, and see in 2025, we're only getting about $200,000 more, 2026, 200,000. And, as you go through these numbers, big picture are roughly the same, somewhere between 150 and, just over $200,000. I won't belabor that. You'll see it's relatively consistent. And then there's a bit of a jump down starting in 2033, goes down to 140. Then in 2036, it goes down, slightly thereafter. This is our total number, just shy of 3.5 million. So, I mean, we have about a third, just under a third in the bank now. And then the remaining is roughly, even money over the remaining period of time.
Cool.
This was linked in the agenda. And when you go to this website, what you'll also see is a second link that has actuals. And so what I'm showing you here are estimated payments. The recoveries could vary over time, and so we could receive, more or less. I don't know if Jenna, is there any point in time where we're expecting to receive significantly different amounts, or the estimates so far have been kind of close? So I don't know if there's any, should we be concerned that in the out years, it could vary significantly? I don't know the answer to that question.
I don't believe so. I have heard that there's a couple other suits that are happening. I'm not 100% sure of how those will play out, but I haven't heard anything of that it should fluctuate drastically at all. Like obviously these are expected and there's probably a slight variation, but I haven't heard anything like that or that it's happened to anyone. So that's all I know.
Great. Yeah, and I have seen some email traffic on some of those other suits as well. I think it's probably too speculative. In my 1 month I've been here, other suits have come through. So probably very speculative to try to predict what the outcome of those might be.
Sure. Comments, questions so far on the numbers? No.
I'll stop sharing unless other things to see.
Okay. So there's the groundwork. But, as to recap a bit, I think the direction that I heard that we wanted to head in is to come up with potential programs or things that needed assistance that we could use these funds for. But at the same time, keep in mind, we want it to sustain itself. So that it isn't gonna fall back on the taxpayers, because that is a huge issue for the constituents in Bangor is the taxpayers. And, we want to keep that in mind, and this information that will help us make decisions, then we'll do that, hopefully.
Can I ask a question about those numbers?
Sure.
Initially, when I started, it was like 1.4 million is what we had to spend this year or sooner than later. But I feel like you're saying 1 million, so, but they only used 100,000 of it?
The 1 million is what we have in the bank to date.
Yeah,
I suspect the 1.4 is if you add in what we would get this year.
I see
But
what
let
you're
me pull
saying.
it up just
Okay,
to
yeah.
make sure.
When do those payments get put into our account?
I don't know the answer
Okay.
to that question. I think it probably varies quite a bit, because I think it's dependent on when
When they pay out?
and then it goes into a big pot and then gets slowly sort of waterfalled out. So I think there's probably quite a bit of variables, but let me just make sure that was accurate, what I said about the 1.4.
Yeah, I just remembered that, hearing that number, and I was basing my thoughts on that number about
Yeah, that would about work out
to what we're gonna get.
if you
This
include
year.
2025.
Okay.
Yep.
Thank you.
Okay. Does everybody have their? Did you bring your copies? I've got copies here. You've got some too?
I have a little copy.
Oh,
You got
that's right.
Great, thank you.
Can I just add super quick that if you look on the other link, the actuals, you can see there's a variation, just to kind of expand on that. By date that it was received, you'll see like a variation from March to April or May. So like, I think it just depends. There's certain time periods. So again, like you said, but you can look on that actuals tab and it does tell you the variation of the dates and I think there are more to come. So there's no exact. So anyway, just that other tab is it just explains it a little bit more. You can see a little bit more.
Okay, so the first document we have to look at is the actual, this is going to be the funding recommendation for number 1 for us. So we'll walk through this, get questions answered, the hope is that at the end of that discussion, we'll be able to take a vote to move it to council. Um, The attorney says we can vote or not. Personally, I would rather see this committee vote to make that move to council. And then it shows that everybody was involved in the process. Okay. So, thank you very much, Jason, and, where'd you go, Jamie? Nice job. Do you wanna walk us through it?
Sure. So based on our conversation at the last meeting, I volunteered to put my interpretation of what the thoughts were that we put together. This is what came out, so there can be editing done if we need to, prior to it going to council. So the first paragraph, funding recommendation number one. The committee recommends that the city of Bangor immediately hire 2 intensive case managers to respond, assist, and coordinate and enhance services and system navigation for individuals who've been diagnosed with HIV as part of the ongoing HIV outbreak here in the Bangor area. The next section is the need, based on the history and a brief epidemiological profile of what has happened since the outbreak started. And since 2024, there have been 26 confirmed HIV cases among people who have identified as being unhoused, have a history of substance use, and most have had a comorbidity or co-infection of hepatitis C. There have been significant links to the encampment behind the Hope House facility. And since the encampment was enclosed, there have been difficulties engaging with those individuals, finding them to provide treatment, care, and prevention education. Recently, also, the Ryan White Part C case management program in Northern Maine ended, leaving a gap in case management services. The next section is a scope of work. Intensive case management in this situation is defined as provision of frequent interactions with individuals who have been diagnosed with HIV and are part of the ongoing outbreak in the Bangor area. Case management services will be provided to individuals until they have reached a significant benchmarks in their treatment, such as becoming virally suppressed, obtaining appropriate supported living environments, and have demonstrated the skills and sustained progress in their goals, such that they could be transferred to a less intensive case management system. The program would move to a reimbursement model at the end of a 2-year funding period provided under this opportunity.
Can I ask a question? My questions come slower than you're talking.
Sure, no.
I gotta go back.
Yeah.
When you're saying Northern Maine, do you mean Lubec? Isn't that where the,
So Regional Medical Center of Lubec had the federal contract to provide Ryan White Part C case managers for the entire
so
Northern Maine.
Aroostook County as well as?
Yeah,
Okay. I got it.
Scatticus, Aroostook,
Okay, thank you.
Washington, I think was in
Yeah.
there. There's, I think it was like a 5-county.
Yes. Okay,
conglomerate.
I just wanna make sure.
Yeah, no,
Thank you.
hey, I know, because it's like Lubec.
I know, it's just weird.
And they've done it for years and held that
Okay.
federal contract.
All right.
And I have just one question too. What is a reimbursement model at the end of the 2 years? What does that mean?
So we could transition from the settlement funds to main care.
We
Reimbursement.
could,
That is a recommendation. It is not it's a choice, or the program could end. Or there could be other models of funding that become available between now and the end of the 2 years that this funding recommendation would support.
so it wouldn't be on the taxpayers.
Well, main care, Medicare is taxpayer funded,
Yeah, I know,
so,
but
but
I mean on property taxpayers in the city of Bangor, because that's a hard pill.
correct, that would be up to the city of Bangor to decide as how they would, they could create another committee to decide how they were gonna fund it, or the city council could make decisions about how they're going to fund those positions moving forward. That would be in my understanding, that would be a city decision.
I think you're right. Typically, they would look for, and Jamie's done an excellent job looking for grants. All city departments now, if you hear their reports, are talking about grants and finding grants to help their programs. But it probably would be smart to switch over to a reimbursement model, even if it is main care.
And it could be private insurance, it could be
If they
whatever
have-
models the city has in place or wants to put in place.
It doesn't have to just be main care, but it would be somebody other than
The city,
these funds.
other than taxpayers,
Right.
right?
So the intended impact of this short term, we had talked about having some short term, intermediate term and long term projects with this funding. This is a short term, sort of immediate sort of response, and the intended impact is to reduce the mortality and morbidity of HIV among people who were diagnosed as part of the outbreak here in the greater Bangor area. It's to reduce the viral loads of those diagnosed through appropriate and adherent treatment supported through intensive case management. And it's to reduce the transmission of HIV and HCV by supporting individuals to retrieve of viral suppression. The next section was provided to me by the city. The city currently has case managers, and I reached out to Jen Gunderman and her team at the Bangor Public Health to give me a current job description of case management and a budget of current what the city is currently estimates these positions would cost based on actuals that they have experienced right now. So the job description is here, and it lists key responsibilities, qualifications, and experience requirements. Do you want me to read those, or?
No, you don't have to read every bullet point.
And then the city provided me with two budget options. One is a basic budget and one is an intermediate budget that would add a few more resources into the pot, but were able to give us some options around looking at how a case management structure could be structured through Bangor Public Health. And the first budget is so this is for 2 years, two personnel at standard rates. And the first budget totals $510,200, and then the second budget is at $550,200. So I guess we open it up for conversation and questions. I don't know if
Jamie, have anything to add?
Jamie, do you have anything to add on this?
Comments? Questions?
I have a couple of questions. This is for two people. In other words, you feel that it's going to take two people to deal with the existing 26 people?
Correct.
Now, do you think that it's possible? I think that's a lot of money out of what we have. And do I think that we should definitely be paying attention to this? Yes. But I also think there's other ways probably of doing it. And should all that huge amount be going to this one particular thing? I know that that there is other things out there, and I've just glanced at some of them for as far as grants go, and those probably should be looked at a lot harder, rather than spend all of, a huge percent of this, of what we have on this particular. Now, don't get me wrong, I think that it definitely needs to be addressed. I just think that there's got to be a way to make it, this is best case scenario, is that right, Jamie? You want this as best case scenario, is that right, Jason?
My understanding is that these are the actuals for what it costs the city currently to provide in case management services in this, in the context.
Yeah, I get that part, but best case scenario, I mean, two people is best case scenario.
Because this case management model doesn't exist, this is intensive case management.
Yeah.
This is 2 to 3 interactions a week with individuals. This is actually a step above what any current case management model would fund. And so this is I would say a half caseload kind of per case manager. So typically, 30 to 50 people, could be in a case management situation, but that is a general case management. This is a much more intensive, short-term program to really get specific individuals to reduce their risk of transmitting and spreading
Mhm.
HIV and HCV. And what we've discovered through our work with the city and the local partners here in the Bangor area is that the level of case management that exists in right now is not sufficient to cover the need of the individuals who are impacted by this.
Okay, now with the Lubec facility or whatever it was, how many people did they have handle it? I mean, are we,
I think that the challenge with that comparison is that this is an acute group that's not connected to
I
services
understand.
versus the maintenance, because that's
But we're just-
130.
So they had 130 to 170 people on their caseload, and my understanding is they had at their prime up to 4 case managers, but that was 1 to 2 interactions a month
Mhm.
per individual, and it was not intensive case management, and it was mostly the provision of resources to the individual, such as a person could apply for a food card, a person could apply for a transportation, and some other services. This was not going out into an encampment or into and delivering or connecting people to medical treatment.
got it?
It's not street medicine or street.
Yeah. Yeah, I see what you're saying, but is that, of that caseload that they handled with 4 people, what was the percent that was intensive?
0.
Nobody was intensive.
Right. That was not the design of that.
And
case management model.
we know that?
I,
How do we know that?
because I worked with them.
Okay.
Yeah, I have experience in that and funded them when I was with Maine CDC.
Okay, now, as far as Maine CDC goes, what are they willing to do?
They are not a case management provider.
No, but what are they willing to do for funds? Are they willing to do anything?
They're not a case management provider. Their funding is dictated by federal CDC
Yeah.
for prevention and treatment.
Okay,
And so not for case management. So Ryan
for
White,
prevention and treatment,
yeah,
and what case management involves both those things? Prevention and treatment, but definitely
and
treatment,
linkages to,
correct?
not the funding of.
Mhm. Okay,
Can we get a couple of hands here?
Yep.
Scott, you've had your hand up.
You guys hear me all right?
Yeah.
Yes.
Cool. I've gone on kind of a bit of a journey with this in my head and also with some information that I've received from different pieces of information from different places. I echo Scott's sentiment that spending the entire or a good majority of the money that we have in the bank on one thing kind of stinks. However, I also think it's necessary whether we like it or not. I will say that CHCS recently posted 2 specific case management jobs for HIV directed service. And when I saw that, I was like, I thought I asked about this last time and this wasn't a thing that anybody could do. Well, I talked to Dale about it and he said he specifically talked to DHS and they were able to set aside some state money. So it wasn't like a known thing. It was like a new thing. I don't have any experience with helping people with HIV. So I went to somebody I know had done that job and I asked them about it specifically. So I was like, well, do you think it makes sense to have more case managers if we're already doing case management over here? And that person told me that that's an entirely different type of case management that would not be sufficient. If we want to help these people and eliminate this threat to our community, we need intensive case management, possibly even medical case management, which I would like some clarification on for you guys if you have more explanation, because I'm not entirely sure what the difference is. But without that, this probably won't get done. And if we try to do it half-ass, we're just wasting money because it's not gonna get done right. Yeah, that's all I wanted to say, basically.
Thank you,
Okay.
Scott. Jamie, you had your hand up. And you took it down.
Yeah, I just wanted to, I wasn't involved with creating this, but I just want to emphasize that when we pull together proposals, they're based in evidence and they're based in experience and it's based in, all of the many years that staff have been working hand in hand with these populations. So it's not an uninformed proposal is what I'm trying to say. Anything that you see come from any come from the public health department or any public health department or the city or I just want to emphasize that we're not making these proposals in a vacuum, that they're based in experience and in knowledge of, employing people, supervising people, retaining people to do the work, is really all I wanted to say.
I have a question. So if you have these two caseworkers dealing with the 26 people, obviously when they go out into the city and, beat down the streets, they're gonna find more people with HIV. Are these two people capable of handling more? About up to how many more?
So the traditional path is that somebody gets connected and that, case management is not always along. The plan is to transition them to, when they reach certain benchmarks, transition them to more appropriate levels of case management. So if somebody is having success meeting their goals, that they would leave the intensive case management and go into, and then make room for other people. I think the caseload level would accommodate, with two people, would accommodate more than 26 people over a period of time. I think that would be something we'd want to monitor and have serious conversations with the case managers to see, to see what the need is. If the need became greater, if there were to be an additional 26 cases came up, we would have to really think about whether, where other money, at that point, because of the level of, that's a huge outbreak in this day and age
Then it'd
for
be-
HIV.
Yeah.
That there probably would be some other resources based in public health strategies that we could ask for. So I think that would be, here's what's in front of us right now, and
Right.
here's how we want to sort of address it, kind of approach. We know that there is a ripple effect, and that we will identify more cases. But as we engage in this, we are going to stop, if we get people treated now, we're going to reduce that viral load within that community and really create some safety for people.
Thank you.
I have just one more question. I think these people, these 26 people that have been identified, are they being treated now?
About half have already received some treatment, and about half have already made progression towards their viral suppression. The issue is that because people are continuing to be in unhoused situations and are moving around the Bangor area because they have no housing, or housing is not an option for them because of past experience or past history, people are missing doses, which then impacts their viral load, and then also can create a chance of drug resistance within. So
Yeah.
the more doses a person misses and restarts, the
Jump
higher
all
level
over.
of resistance which then could snowball. And, this is why we really want to get people treated on a regular basis. And there are really great options now. There are injections that last for periods of time. And we have medical professionals, partners. Hope House Clinic is doing a fabulous job. Northern Light, St. Joe's, all the major players in this area are really, Bangor Public Health, and connecting with the people that they can. But what we're seeing is that we're spending months trying to find a person to get them their shot. And in that meantime, they've missed a dose, and that we are at a place where it could be, they could have, their viral load could have changed and gone back up to transmittable, and they could be in a situation where they are putting other people at risk.
Is every one of these 26 people are unhoused?
I don't know the exact number at this
Okay.
point. I think that's some have had success in getting housing vouchers, and so there may not be a need for exactly 26, but that was a target number.
Yep.
Based on, and so there may be people who have had success and they don't need the intensive case management, but there is a a group of people who are doing case assessments on every single case, and that can be determined not by us, but by the clinicians and the professionals who are trained to make those kinds of diagnoses.
And this is going to make a difference on finding the people that we can't find?
I hope.
Oh,
Yeah,
It's not so much that we can't find them, Scott. It's that it's nobody's job to run around and find them specifically. If we have an intensive case management, it's that person's job to find those 13 people regularly and know where they're at. So that we can get their viral load to 0 and hopefully eliminate the cluster.
Thank you.
that's what I was essentially gonna say, the same thing, that the population becomes more and more unknowable the farther we get away from case management services, because now it's been a month since they've had a really controlled interaction with someone, so.
So I'm kind of cheap and
me too.
I don't understand, I guess what I was wondering is, how did you come at the amount of $1,000 a month for rent? Is that like a building? Within
It's
that
office
building, does
space.
he rent the office space already, or, I'm just asking.
Yeah, so. Jamie, go ahead.
I was just gonna say, if that is based on the idea that they would be housed here at Bangor Public Health, that's about how much each office space goes for. That's the price of office space.
Should they be in one office, two people in one office? Or was that for two offices?
Probably each would have their own.
They would
Okay.
need to for privacy reasons if they're meeting people.
So
like
that's,
that,
yeah,
I would
okay,
imagine, yeah.
yeah.
But you already have the offices available?
Yeah,
That belong
we
to the
do have
city?
space here, yeah.
We lease that space that they're in, so we pay rent.
But you already have the space.
Two case managers,
We have there is available space for lease there.
two case managers.
The space that we're in has other offices for lease.
That you already lease.
I don't
I-
think so.
And they, they may also instead be housed at the Wabanaki Center, which is an option too. There's space there, and rent, I would imagine, is pretty comparable. So I may have misspoken about that, but I think either spot.
I think there would also be the question of where is the most efficient place for them to be located,
Right.
because I think. Jamie, you can correct me if this is a misimpression, but your office may not be the most accessible to the population on a day-to-day basis.
Yeah, absolutely.
Scott, you have a comment?
Just a question. So is Wabanaki part, or I want to be keeping on them. Are you guys partnering with a different agency to hire these case managers?
This case management is being hired by the city. It has nothing to do with Wabanaki staffing or our agency, other than we sometimes provide space for other agencies to do their business in.
Yeah, I'm sure that if it were needed, other agencies would do the same thing. I don't know. Again, I really think, and I'm not gonna speak for anybody else, let's just speak for myself. Even though I've come to the understanding this is necessary, I don't really like it. I don't like that much money. I don't like the fact that the city's getting all of that money when this is like opioid settlement money. But I do think it's necessary, and there is a lot more money coming down the line that other people can access, which I think is an important thing to underline. Like, if this is the money that's going to the city, great, but the rest of that probably should be for other people. It's my opinion.
Right, and this,
I second that, yep.
one of the things that we had talked about at the last meeting is looking at some different approaches where there would be some for public health interventions, and this is that, and then there would be money, the rest of the money would be put into RFPs or other programs based on this committee's recommendations.
And you know, you look at it, okay, 26 people, $500,000. Like, I wanted to help a lot of people, you know what I mean? But I guess when you think of it in the way that Scott's saying, it has to be done, and we need to take care of HIV before it becomes a lot of people's problems, you know what I mean?
This work is very expensive and it's the
Yeah.
hardest work that this community and the public health system is doing right now.
And you can't not do it.
And I look at our comparable, we run a detox facility where I work for 10 beds, appropriately staffed with appropriate medical, and it's over $1.5 million a year
Yeah.
for 10 beds. That's a lot. That is the true cost of doing this work. We're lucky to have great partners in the state and federal and other places to help us make that. This money is not part of that, but I'm just saying when we look at what the cost is for engaging in substance use work, it's not cheap.
Certainly isn't.
Can I ask a leading question?
Yes.
Because I think the 26 is maybe an underestimate of the number of people. Because I think what I heard you say is the model is sort of, 26 is known cases, which undoubtedly means that it's
Cause it's double.
more. But the goal is sort of a roll on, roll off system. So probably over the course of 2 years, it's far greater than 26 people that would.
Yeah.
Mhm.
And I think that, using a model that sets benchmarks and allows people to access other services that then frees up that space was our intent. Some people are gonna move through the system a little faster and some people may need more intensive work. And we can't predict what that's gonna look like, but being able to say at the end of 2 years that we know that this is a limited intensive action and that there are still other opioid settlement funds coming in to fund other programs and other initiatives.
I guess I also wanted to challenge the idea that it's helping 26 people. Because it's actually preventing harm to many, many people.
Right,
Remember
a
that
lot
we
of
don't
them.
even know what
Yeah.
that number is. And so it's 26 people are the target, but that's not
Yeah.
Mhm.
the full picture.
No, it's definitely
of the
double that,
health.
I'm sure.
It's-
Yeah.
Well, I think it's more than double. I
It
don't think you
probably
have
is.
to receive a diagnosis to be impacted by what's happening right
Mhm.
now in Bangor.
Yep.
And it's the larger goal is to make everyone safer.
So with this spike, I'm just getting off track a little bit. What is the state doing? Are they doing anything? They know about it. I saw it in the Portland paper today. I mean,
Yeah.
everybody's aware that this is the hot spot. So what's the state doing?
So
You
I think
know?
what we've identified is that there's a thing that can't be done right now through any existing funding. And so this fills that gap. Ideally, we don't need to continue this. Potentially, it
Mhm.
changes the model. You also have 2 years where there's time for other funds to back into it. There's a lot of unknowns right today.
And let's say after 2 years, the HIV issue in the greater Bangor area has resolved itself and things are back to sort of status quo, with whatever that means for the Bangor area. This intensive model could be, let's say there's another issue, but it could be prenatal care. And we know that there's a group of moms who need prenatal care. This model could be transferred to a new issue within the city. It would take some funding and, a rethinking and probably another committee and stuff, but the model then would have had some a chance to be looked at, successes and challenges to be identified, and to see whether or not this could be replicated in another way. There probably could be federal funding, depending on how things get ruled out under the new administration, to take successful models and replicate them for different populations.
But we haven't reached out to any of our senators, right, or congressional people. I mean, King and
Yes,
Collins and.
I mean, the state has no more money to put into this because their money comes from the feds and that federal money is being cut off at the federal level. And so
Sorry, I would just add, so like you said, you asked what the state was doing. One of the funding that's still available in human service right now is like CCBHC funding. Not all agencies use that, some agencies do. It's not specific to HIV, that's not really like a thing, but the state kind of bent the rules a little bit to allow them to make it specifically about an HIV population. However, that dynamic is not It's the type of case management these people need to be transferred to once they're stable. Which is another thing I just kind of wanted to point out. In general, I feel like our agencies don't always work together real well, and sometimes we, all trying to do the same thing at the same time and don't get a lot done, so I think it's really important to have that kind of set up. How are we gonna slide people from this to somewhere else, whether it doesn't matter where it is? There was something else too, but I forgot what it was, so I'm gonna shut up for a minute.
I wrote mine down. So am I just thinking about this, like 510, that's for 2 years, so are we paying half of that for this, year and then half the following year? Or do we have to have all that money somewhere to pay for it? In like the year later, or do we take money from what comes every year to pay them? Do you know what I'm saying?
So my understanding of how it works is the city council
Okay,
would encumber this money, which means they would put it in a special tank.
yeah, okay.
And
All right.
aside, right, like in a special account to say that this money is for this project.
Okay,
It's already in the bank, right? And so
And then
they
we're
would
putting
say,
it to-
we're gonna reserve this money for this cause, and they would vote and approve that.
and it'd be the full amount,
And they-
holding it right now.
Yeah,
Yeah,
and then
okay.
So
the
that,
other funds would be coming in as well.
so that would take away from the $1 million, it would take half, right?
Right, yeah, yeah. And then my other question was, I don't, there's people who just don't want help. And they refuse it, or how do you guys figure these people into is that what a case manager does? Talk them into it, or,
Well,
you know what I mean? Of the 26, maybe 10 of them don't wanna be bothered?
So I started my day,
Yeah.
actually, you were there with this very same conversation. If people are receiving help that's beneficial to them, they take it.
Okay,
So if you have a person who's resisting services, the problem is not the person's
Services.
ability to accept your services, it's your ability to deliver them.
okay.
And we see that in the current model because it's a 30-day check-in. And what we're talking about here, this is what the youth world has used for a couple of years. Where you basically become the person in their life that is consistent.
Okay,
You have value, you see them, you support them, you get things done for them.
and they see the value in that.
Right, they're seeing motion. If you see a case manager face to face once a month and all that's happened is you've managed to sign your food stamp application,
Mhm.
that's not accurate, but I'm kind of
Yeah,
being
yeah, I know what you mean.
hyperbolic about it.
Yeah,
That's not a relationship, that's a transaction. So getting that caseload down, now you have a relationship that works for the person. They don't turn you away. They open the door when you come over.
thank you, that explained it very well.
and I think, to remember that people still have the right of choice around their healthcare. And that we are never going to convince 100% of the people, 100% of the time to
Right,
do
right,
anything.
right. But I wouldn't
But-
wanna set this up and then there'd be a large amount of people that say, I don't want it, you know what I mean? And then now we have these 2 people who are just doing 10 people with HIV,
Based on the
That
work,
job.
based on the
Yeah.
work that the city is already doing and that the partners are already doing,
Yeah.
that is not what we're seeing. We're
Okay.
seeing that it's a lack of continuity between the existing services
Okay.
that happen. A lack of coordination, we have many different providers trying to work with people at the same time and people are confused about. And so having somebody to help coordinate that communication so that the providers can actually do the clinical work they're supposed to be doing and not,
It'd be the same person they see every time.
yeah. And, somebody may choose to use a different service and that means that
Mhm.
there's a spot for somebody else,
Yeah,
right?
okay.
And so in my mind, we do the work that we can. And, do it with good quality.
Mhm.
I think too, if you have dedicated access to a person, at some point, and this is my experience again with youth, is that there's a moment where someone is ready to engage with services.
Mhm.
And if that service is there waiting, they'll take
Mhm.
it. If engaging with that service means I need to wait for a referral, that I'll hear back about on my broken phone in 45 days, it's gonna pass.
Right.
And so this is a person that will always answer the phone when they're ready.
Yeah.
And that responsiveness plays into it too, because it's.
And setting up other systems, which I think is one of Jamie also presented a different program too at some point, that she had sent in, but things like, if you're prescribed your HIV meds and you have to take them orally and you have them in your backpack, but every week your backpack gets stolen because you're living outside, that makes it really difficult.
Yeah.
And so working with a case manager to maybe think of a place or a safe place where meds could be given on a regular basis and not making that, you're taking that pressure and helping that person to learn those skills and to build that, that competency.
Thank you. Is there a patch?
No, not yet.
Alright, so nice.
No, I think Jason has done an exceptionally nice job outlining this. I think we all agree this is a very present and real crisis in our community. We have the good fortune to have the funding available to us right now. I will be very supportive in voting yes to move this forward to the council.
And to the city manager's point, when we last were given the numbers, that was brought up, that there are many that will not test because of stigma, because of not getting there, not knowing where to go, they just won't do it. So there probably are several more that need the services, but they have not been formally tested.
Jamie and Jen at Bangor City, Bangor Public Health, and several of the providers have initiated a testing incentive program, and I see that there are incentives listed here for different purposes to be used, but getting people, getting a $10 Dunkin's card means you might get something to eat today. And it means you get to engage with somebody who cares about what's going on in your life. And it means that you might get some services today that you didn't get yesterday. And so we're finding that those low barrier, low cost efforts done over a period of time really do help. It's increased our testing in the city of Bangor a lot in the last, so the testing is being paid for by the state and by Fed. So that is not part of the, is that in here? I didn't know.
No, I didn't see
The
it.
testing itself.
Yeah, that is paid for through a different program, so that is an action that CDC is doing.
Yeah.
Okay.
Yeah,
That's nice.
I knew one would pop in there somewhere.
I would probably be, I'm with Scott. I don't like seeing this much money going to the city. I think that was an issue with the counselors when this opioid committee was coming up, that because the city wanted it all. And, there was a lot of pushback on that. And, but I do see the need for this, but I'd like to see no more money go to the city other than this. And the rest be, because it's been cut down greatly, but it's needed. It's absolutely totally needed. We're forced to do it, I guess. And if this is what we're going to spend half of our money in the bank on, then so be it. But I certainly would not want to see any more funds go to the city. That's my opinion.
Jamie?
Hi, yeah, I just wanted to say that this is a role we're stepping into because no one else can do this right now. So, I also would like to just underscore that we at the Public Health Department are almost, the only entity who does provide primary prevention. So I think, to not consider other strengths of the city and city staff in making good use of this funding could be short-sighted.
Scott?
Yeah, I would just think that whatever remains would be open to everybody to make a proposal to get, especially if we're talking about a specific service. Like we said that this needed to be done and then decided the city was going to do it instead of offering anybody else to volunteer to do it, which is fine because that takes time and we don't have time. We want to get it done now. But I think for the rest of the money, it should be open to anybody, and whoever's got the best plan, the most likeliness of actually getting whatever it is done right, should get it.
Do we propose a motion?
Can I also just really quick say, at least I'll speak for myself. is not meant to be like an insult to public health in any way, shape, or form, or even the city, because I get that we're all on the same team. It's just kind of like, for me, it feels like this money is for addicts and it's for, the families of addicts and for the addicts that aren't alive anymore. And then to like have the city take it feels like it's being taken by the city, which is not really the truth, right? Because we're using this money to help addicts through the city. It's almost an optics thing, but it just feels, I don't know. It's not meant to be an insult to anybody personally. That's all I just wanted to say.
Yes.
Can I just ask Jamie, do you have anything to say, or anyone really, about sort of looking at the basic budget versus the intermediate budget? I mean, I think the primary difference, if I'm correct, is that the more expensive budgets for transportation, purchasing a transportation option to get people to and from appointments, as opposed to giving them, bus cards and things to get to and from appointments. Would you make a strong pitch for one of those options over the other?
Well,
And there's one for administrative time. Yeah, that's extra.
so
I would.
I'm okay, I would support either one, yeah. What we're seeing is that bus passes and vouchers get stolen. And that when somebody says, I'm gonna pick you up at the footbridge at 10 o'clock tomorrow, it makes it accessing services a little easier. I understand that it's a cost, and I don't know what the city's transportation policy is and whether they buy vehicles or rent vehicles or how that works. I'm sure they figured that all out. But that's, the need is that when you have to go out to behind Burlington Coat Factory and then bring somebody all the way back into town to get a service, their options are very few and far between. And so I understand the need for that, but I also am okay with the basic, me,
Yeah.
Jason personally, am okay with the basic budget because I think it's a good start and it's a good, but I will defer to, Jamie, I don't know if you can speak to that or not.
I don't know if I can either.
Okay.
I mean, I imagine it's more when your case manager shows up in a vehicle and says, hey, it's time to go to your doctor's appointment.
Yeah.
Your likelihood of going is greater than if you have to make the decision to walk to the bus stop, wait for the bus, if it's raining, if it's, all of those things can go into someone's decision to participate.
And it's also using a transportation system that is not a private one. There's less chance for liability, there's less chance for safety issues, that sort of stuff, if it's vetted through some sort of system rather than me or you using our car
Yeah.
to go pick up, which can happen and does happen, and there are case managers who do that. It just creates another level of risk for both the client and the worker.
Can medication be brought to them?
Yes, in many situations that can happen, and
Okay.
that's one of the.
I know doctor's appointments,
Yeah.
they're not gonna go, but.
We have providers trying to do that right now, working really hard with options teams, path teams, home teams, city employees, trying to find people saying, okay, if we can meet you here, will you take your med at this time? And they, show up and that person can get their med not in the
Yeah.
clinical setting, but
Yeah.
it's the street medicine model where you bring the medicine to the people is being implemented right now. It's just not coordinated in a way that people have consistency.
I'd love to chime in for a second.
Go
And
ahead,
sort
Scott.
of echo a sentiment that had been said previously in a different meeting, and I think everybody can get behind. If we're gonna throw $500,000 at something, we should probably make sure that it works and not spending $40,000 in the hopes that people will take their bus tickets and not trade them for drugs or not find somewhere to get high along the way and forget or whatever is crazy to me. So yeah, no, spend the money.
Has anybody tried implementing the street passers that go out the street?
Those guys in the orange shirts.
Yeah.
Okay,
Those
those
ACOs.
people.
Thank you.
Let
No.
me tell you, We have people who are experiencing homelessness that won't work with Path now because of these people in these orange shirts and the way that they treat them and the way that they bring police down on them. And like,
Oh,
so,
okay.
yeah,
All right.
they're not a fan of those people.
They are those people, all right.
I
Okay,
think it's a very complicated relationship that's developed, and I think it's really hard to. I think using that resource in maybe a different way, and that understand, maybe there's room for more communication and better coordination of how that service works within the city. I think this is a good start for that conversation. So,
Okay.
and they have a specific contract with the city to do a very specific job, and HIV case management is not one of
Not part
them.
of it.
Yeah.
Mhm.
Okay.
Okay. What are your thoughts?
Do we take a vote? Is that what we
We
want
are
to do?
going to need a motion, yes, to move it to, take we'll have this presented as a recommendation to the council.
I make a motion that we present it for the full $550,200 and, hope for the best. I make that motion.
Do I second that or can I
Yep.
second it? How's that? Yeah, I would
Just
second it.
did.
Yeah. I would just, can I add in one thing real quick while we're still talking? I think it's really important to make sure, and it seems like an odd thing that you probably shouldn't have to say, but there should be some experience or some specific trainings lined up for HIV stuff. Cause like I've got a bachelor's degree in mental health and human services. I'm, in my own opinion, a great case manager, but I don't know anything about working with people with HIV. So I think it's very important that that box gets checked.
And that is in the experience and the key responsibilities that we didn't say out loud, so there should be some, you know.
I think the salary
Okay.
demonstrates it's not an entry level case management, because there's experience behind it.
Good point, Scott, thank you.
Okay, so we need to do a vote. All those in favor of this going to, full council as a recommendation
Full amount.
for, yeah. Everybody.
We have one member not
Yeah.
here tonight. Lisa.
So you're down one, yeah. Okay, so we will, that will go. The next,
When is the next council?
What do you need? Is this enough for you for it to be presented to city?
I'm new enough that I have to figure that out.
well,
Yeah,
it should be fine. It's just gonna have, we'll just
David.
type it, yeah,
They do as well.
yeah, they'll doctor it up a little bit.
Do some of us need to be at this meeting too?
It wouldn't be a bad thing.
Okay.
I'll be there. I'm usually there.
Yeah.
it will not make the meeting for this Monday.
Oh,
It
It will,
won't?
it will not.
so it's another month?
No.
I don't
2
know that
weeks
there's-
After
Oh.
that, so
Okay.
they meet
That
twice.
it's gonna be able to get drafted. I mean, we sign the agenda tomorrow at like 8 a.m. to get all of the paperwork out.
Okay,
So,
so be it.
That's another 2 weeks, so
Yeah.
with nothing happening.
Is there any capacity to start that ball rolling at public health with the understanding that this money is coming your way?
Well, we can't say.
Not without.
No,
So,
you wouldn't wanna do that.
no,
If the council hasn't
They may not.
approved
like
the
it.
recommendation,
it's out of
you
our
wouldn't
hands.
wanna go out saying that you had the funds to start.
Yeah, good point. Sorry, I hadn't thought that through thoroughly.
It's a good point though, Scott.
Can we do it?
We're all excited now. And then,
There's just no way it can be added.
Can we do it on the next Monday, a week from Monday? As a special at finance,
we could have
because
it
that's a committee meeting.
go to the finance committee, but I still don't think it still will require a full council vote.
It's gotta be a way to get it started sooner.
Maybe try.
you try really, really hard. And you can't.
Because you're signing the agenda tomorrow,
Mhm.
but
Oh, if you assign it, you can
David
just
could-
assign it and then
Well, we have to, human beings sign each of the orders. And so it will be a,
The order has to be created before it can be put on the agenda.
Oh,
yeah.
So we can't just bring it up in open forum. Right?
I would.
I know you would.
But they, yeah, you can bring it up and let them know it's coming, but until they
not-
have
yeah.
the actual recommendation in front of
There'll
them.
be no discussion on it, I suppose, till then.
Well, that's too bad.
If that's the way it is, that's the way it is.
But at least it's not a month, it's 2 weeks,
Yeah.
right? Like, so
Yeah,
there's,
it goes to the following.
Yeah.
Just make sure we get on that next one.
Yeah.
When is
Okay.
that one? 28.
I'll try to think through if there's any sort of,
Well, if you have a magic wand and you can wave it, wave it. And if not,
Yeah.
If
we'll
not,
have to
we'll
go
wait.
with it.
Yep.
But all of the information is in the document that they will have, so that's, they shouldn't have to wait. for
if you need to
any more.
call me in the morning. I'm happy to.
no, my
Just
wheels are
clear.
turning. I'm just,
Yeah.
I think, I'll try to get it
But it,
on for Monday.
back to whether you should be, it would be nice if there were some committee members there when it's
Can you
presented.
just tell me the date that it is? Cause tomorrow you're trying to, Monday you're gonna,
So it will either be the 28th
yeah.
or the 11th.
Okay, perfect, thank you.
Okay, so. That's on its way, and we'll get it in there as soon as we can, and. The other things that we got. Probably will hand out the copies, and then. Maybe this can be homework. That if you take it and
Promise to read it.
this is the one that, Jamie
Oh, yeah.
submitted this, you may have a copy.
All of it?
Just one page, right?
Just one page from each file.
Oh,
Can I ask a question about that? Or
Yeah.
maybe like float an idea? There's
Go
an
ahead.
agency in our town in Bangor. That's very likely, not but almost imminently going to be closing because their funding got screwed up because somebody didn't hire a grant writer correctly. And they lost their funding. It's called the Together Place in Bangor. They really need funding in order to stay open. I'm wondering if there's a way to incorporate this thing that was this idea and maybe house it there in order to help them stay open. I would think that would be a great 2-for-1, just by opinion. I don't know if they're open to that either. They are technically a mental health place, but they do also offer recovery stuff too, so. I will
Wouldn't that be
say,
under- would
sorry,
that be under an RFP?
yeah, probably.
Yeah.
I was just saying, because there was this one idea that, the other idea that was being floated about a prevention center, that if we could incorporate that there, it might help them stay open.
Oh, the one-stop shop, you mean? Scott, is that what you were thinking?
Yeah, whatever, yeah, that's it, yeah.
Oh, yeah. I think there was some, correct me if I'm wrong, but wasn't that floated by the council before, the one-stop shop? And they turned it down because they could get the money from other grants?
I think that's
recall
what led to this committee.
Yeah.
Yeah, that led to this committee.
Yeah,
'cause
and
it
so
was turned
I think
down.
if it comes from the committee, it's a different,
Got
it's a
it.
different pathway.
Yep. Yeah, but I do know that grant.
Can we, as a committee, recommend a sole source contribution or sole source payment to an organization within our community that is struggling and has proven history?
Yeah, I would say just real quick to, not to, whatever. When in early recovery, I was unemployable. I didn't know how to have a job. I could barely function as a human being. I was able to go there and start recovering and then recovery coaching and then become a paid SIPS worker and then start going to college. And now I'm a professional. That would not have happened without that place being there. And that's not just my story. It's the story of a lot of people. So it would be detrimental to our community to see that place closed, especially the Second Street area. They go to great lengths to keep that area as clean as possible.
Yep, they do, and you're right, and we've had many people from Fresh Start who go there on a regular basis. It's part of our rules that you attend meetings, whether it's the barn or the Together Place, and the Together Place offers
Yes.
meetings also. And I'm a big fan of the Together Place, and I I know, Scott, there's other things going on behind the scenes with that, and I just need to leave it at that.
To answer your question, I think the committee is welcome to make any format of recommendation. I think it would be more about how council would receive a specific recommendation to a specific organization.
Yeah.
But I think we have a lot of autonomy, or you have a lot of autonomy as a committee to make that sort of recommendation.
Sometimes just making the recommendation will get the thought processes going in in that direction. And it may not end up being that particular.
I think we would need to have a conversation with whoever is in that leadership role at Together Place to find out what their need really is.
It's substantial.
Yeah, yeah.
His name is Joseph Artel currently, although they do have a board, but he's the director.
He's the ED, yep.
And with that, based on could this committee do a ask out to them without, does that fall under public? I'm like, would that have to be done? Would we have to ask them to come to this meeting and have a conversation, which I think probably is the answer is yes, but.
It's the best answer.
Yes.
Because then you're all gonna hear the same responses and have the same discussions. We talked about potentially bringing groups in when we got ready to do RFP things, and we're probably gonna be doing that soon, because this one was done without it because of the urgency.
Right, and so probably next we should really get on the stick and get our RFPs out. Cause this is all the money we've got left, so I think we could do that easily, right? We could put RFPs out right away.
I think the question I would have for folks is whether there's any sort of public input outside of an RFP process that this committee wants to have.
You mean to have somebody come in and advocate?
Yeah,
Yeah,
There should,
I think that's.
they should
yeah.
come,
Absolutely.
because you're gonna learn more about what they're really looking for.
Right.
So, Jamie, you have your hand up. Scott's was up and it's down, so I don't know.
Oh,
Jamie?
yeah, I was just, like back a few steps. There was like a small sentence or two about perhaps placing the proposed one-stop shop at Together Place. I think we've moved on, and I think it's two separate lines of conversation. So the enhanced SSP would enhance services at the syringe service program. I think Together Places is another issue. And then the other last thing I kind of wanted to point out is that at the Moss Center, they have an RFP geared toward these kinds of projects. So I think that before we decide to go with any kind of RFP, we at least need to vet that one because it's being used in this situation all over the state.
We can get a copy of it, take a look at it.
And
I
Jenna,
can
is that
send
something
that.
you're familiar with?
Yeah, I can send that along to you all after the meeting. And we basically, the one thing to know about our templates, it's a template series with budget and scoring rubrics, etc. that we can tailor it, and we can kind of do that behind the scenes work after you revise it in collaboration with you all, but we can do that behind the scenes work to get it to be where you need it to be and want it to be based on your input and adjustments. It's a template, but it has the language and all the information that's relevant to the settlement funds, which makes it a little bit easier than like pulling necessarily from an ARPA that you have to add all this other language. It may be that you want to combine pieces of it. I know Aroostook County did a combination. We kind of came in a little bit later and they did a combination. So like there's a lot of ways to do it, but that's what we are able to do, is to support you in the creation of that document. And if you want it to be an online document, we can create that and make that for you once you get all your details out. So absolutely, I'll send it along, and just know that we can tailor and customized, so to speak, for the city and the city of Bangor's desires and your group's desires. Thanks, Jamie.
I'd like to propose a motion based on that we invite representative from Together Place to
Joe.
join us at our meeting.
Yeah,
Yeah.
second that.
Okay,
I'll let him know.
if there's no opposition, we'll just send an invite.
Mhm.
They're not, anybody opposed to having them here from Together Place? Okay,
Scott, when you reach out and just get confirmation, you can connect them to Dave Warren. And he can make sure they have all that information, a meeting invite, a Zoom link if they need it, all of that stuff.
My guess is Joe will show up in person. He's a charismatic
Okay.
fellow who likes to make his case.
Yes.
I also, I don't know, this is not a formal proposal, but if we could come with like 1 or 2 questions that we'd like to know more about.
Together Place.
Yeah.
Yes,
That we would,
bring questions.
yeah, that
That's
we would,
always helpful.
so that we can use our time well.
I think that, you know, one of the first things is that if we were gonna entertain some kind of contribution to them, it would have to fit into the settlement fund allowable
Mhm.
uses. So that would have to be kind of the first, you know, layer of vetting.
We're not making, like, no promises, just exploratory.
Right, this is just really to get a sense of
What the
where they're at.
situation is, yeah.
Yeah, what they might need, and, yeah, absolutely, we have to follow the guidelines of what you can spend the money on.
But I think it's important to hear from a local partner who's in trouble right now,
Mhm. Yeah.
specifically with some of the options that we have around this.
Yeah, so I was
So,
trying to be clever about crossing purposes with something that we need to get done that would also kind of save their butt, you know?
But this is an opioid response tactic, right? Like, they provide a lot of great services, like you just outlined in your own life, so I think that's.
so we're gonna get the RFP sent to us. You've got the 2 pieces that were left to look over. So we'll have to have the discussion about the RFP, how you wanna handle that, we're gonna have Together Place here. So we will, actually, if we're going to talk about
Schedule.
yeah, we do need to talk about that for sure. So some of us won't be here and some of us won't be there. Okay, meeting schedule. Gonna be going to we're going back to the big building. And we're on the wrong Wednesday, is that what it was, Carolyn?
We are on the same Wednesday as the school board.
Okay,
And when we are all back in one building, we are then gonna have a conflict for the meeting space.
So they're gonna move theirs.
I would say not, only because we are an advisory
Right.
committee only
It was like-
to the council to make recommendations. They have to have their meetings.
You could run for school board.
Yeah.
So when is the first date that we would be there?
Under our current schedule,
Mm-hmm.
our next meeting would be there,
The 6th.
the 3rd. Oh, no,
Oh, if you.
I'm
saw that.
sorry, you're right.
Yeah,
Nope,
So we're
so
here,
our next meeting would be here on the 6th.
okay.
And then our meeting on the 20th. There would be a conflict because we would
That's when
be,
it starts.
And if we didn't want to have. Yeah, okay. We'll come to the meeting on the 6th here and then figure it out.
figure it out after
We'll
that.
see how many would have conflicts if we went back to back.
I'm gonna take a big note on this one, keeping meeting for the 6th.
Yes. Yeah, we
Here
do
in
need
this
it.
room.
We do need a place.
20th.
I think that survey that they used, you guys used last time worked really well. We should probably just do that again in the meantime. Seems like,
Mhm.
if we have to
Oh, yeah.
reschedule it.
Dave, do you agree?
Oh, okay.
Yeah, what the question, Scott, we were talking about earlier is, do we meet 2 times in a row in order to maintain the week that we need? Or do we wait and have 2 weeks off to get back on the rotation?
Oh, okay. I say 2 in a row. That's just me. Let's get it done.
Well,
Me too.
that was my thought, because you guys have got a lot of momentum going there. And I hate to give them 2 weeks off and come back and everybody just be like,
What? Yeah, it's a good
so
idea.
we can nail that down on the 6th, for
Okay.
sure. I do have a process question though. If we're gonna have Together Place here. And then we're gonna be talking about the RFP process. Should they be allowed to sit through that conversation?
They could watch it, so,
I know, that's what I'm saying, if they can watch,
yeah.
but I
think
don't think we're formal enough that we have to really
We don't have an executive
break
session.
into
Yeah,
or ask them to step out.
we wouldn't entertain any public comment after our questions with.
Yeah.
So
Yeah.
we would have a public, we would invite them to answer our questions and give us
and
what
then
we're asking for, and then at that point it would.
they'd be done.
They would be done.
Yeah.
Okay.
Is my understanding. We may want to check with the lawyer.
What Dave said, was gonna say.
Yeah,
I think he would agree that it would be okay for them to be here.
yeah. I
So they
think
could
they shouldn't stay at the table.
No.
That's probably
Well, no, but
He probably will just wander off anyway. I know Joe.
after he's done his
Yeah.
part, he'll leave.
He'll take a bow and wander out.
Yeah,
Hey, as long as he's willing to come and fill us in on what their needs are, and that's gonna be helpful for anything we can or may want to do or not do. So,
They're also the only place that hosts hearing voices, alternatives to suicide, survivors of sexual assault groups. Like that's the only place that you can go to those groups is at that place. It's actually really kind of an underutilized hidden gem, but that's it. I'll shut up now.
any other points you wanna talk about?
I expect there'll be other organizations that want to join us at the table as well.
yeah,
I would hope so.
Yes.
And that was the hope in the beginning, is that we would get them to come in and talk to us directly. And they don't tend to take an awful long time doing that. So we could even have,
Set aside meeting for
we could have several
community
come on
presentation or something.
the same night or whatever, it's not gonna matter.
how's that gonna work with Fresh Start? Do you want me to have somebody else come in? I mean, or
I'm in the
cruise
same boat.
myself? and-
Yeah,
You're just,
I
well, we
feel like
won't be home that night.
it's just a presentation, it's not a vote.
It's a, it's
Yeah.
a question, time to ask questions.
Yeah, okay.
Does everybody feel okay with that if Scott is here for Fresh Start?
Yeah, I was gonna say the same thing. I think the ethics comes down to the vote, not the presentation.
Exactly, so,
I'd be in the same situation.
Right,
Rob and I
yeah.
said.
I mean, you're all in organizations, you were asked to be on the committee for specific reasons, and you're all involved in those very groups that we're gonna ask, so. Should be fine, it's a presentation only.
Right, okay. Cool.
And if we're gonna do that at a specific meeting, we need to pick a date and get,
Invites
an
out.
invite out to all of them.
Yeah,
Do we want to talk about date?
ASAP.
I think, yeah, the first time we can get him here, Together Place is coming next time because
If they-
they know him and.
I think it's probably a month. With as busy as people are, people usually need a 30-day notice to be able to schedule an evening
Yeah,
staff. So I would say whatever it is a month from now would be a good, in the meantime, sending out the invitation and getting people prepared, but like.
I
we'll
would-
definitely
I
be
would-
in the
you guys-
meeting.
Sorry.
Go ahead, Scott.
I was gonna say, I think it would make a lot of sense in general, for the most part, if we could if we could get the RFPs out and then know what they're requesting, and then have them come in and talk about it, that would be fantastic. That's just me, food for thought.
I think we have to know what we're gonna RFP first, right? Like we have to build a criteria for an RFP. I think asking community partners to come in, I'm not disagreeing with you, Scott, I'm just thinking out loud, sorry. The intent of having community partners come in was to get a better understanding of the situations that the community is facing and to understand where the gaps may be so that we could write an RFP that would respond to those needs. Or that we could make recommendations for the city and the Moss, you know, to collaborate on making that happen. But I think
Yeah.
I don't know what some of the other organizations' main struggles are. I don't know what you're facing in running recovery homes in your situation and what parents are facing, if there's a parent organization and, you know, what law enforcement is facing. We hear all kinds of things, but having it from the horse's mouth, right?
And said another way, we could also, if we don't do the public session first, we could inadvertently exclude opportunities by how we word the RFP because we didn't even think of this other potential thing that might be really beneficial to the community.
And then often in an RFP process, sometimes, I don't know if the city's ever done this, but sometimes there is a presentation part to your RFP. So if you make a proposal, somebody from your organization comes in and tries to sell you your proposals, and defend their proposal. So I think there are many options there to hear from people who have.
That's awesome information. Thank you. I guess I just didn't realize that was part of the process of limiting the scope of the things that people can ask for or whatever, or we're just trying to proactively avoid doing that by having them tell us what their needs are.
Yeah.
So if we're gonna meet on the 6th and then theoretically meet again on the 13th, probably the 27th is the day that we would do some sort of invitational public organization.
For them to come in.
Yeah,
How long
does
does
that make sense?
yeah, how long does an RFP process usually take through the city? Is it a 60-day, 90-day?
Not that fast. I don't know off the top of my head, but I think they can be orchestrated pretty quickly.
Okay.
And we'll have the template.
Yeah.
You're gonna send down, that's the
Yeah.
guidelines.
Yeah.
As to how we want to present it, but
That would be great.
the meat of it will come from the presentations, I'm sure. Anything else?
Yeah, I guess are we gonna like draft a list of people that we want to come and meet with us? Is that what we're gonna do?
You certainly can throw some names out there, sure. Drop us an email or whatever. And
Is
then
there a
we'll-
way? Sorry, I didn't mean to talk over you.
Oh, that's okay. And then I think also I was just wondering, what happens? Is there a way for people to reach out to request time if it's, you know, someone we don't think of, would want to come? And then also like, is there a, how many people? I just think if it could be really long. There could be a lot of people. So maybe we just need to think about what we want to get out of it. Some questions we want to ask people, a time limit, like just be, draw some boundaries for our process, maybe.
Well, it was already mentioned to write up some questions that you wanna ask the groups. I can get pretty good at sticking to whatever we decide for a time limit. There's ways to do that quite easily. I think if you're just asking, you want to ask a few questions of each group. then keep in mind, we'll know the questions, and if your question is taken by somebody else, go to your next one. So you're not repeating everything, but, we could. I would think no more than 15 minutes to get your questions out there. If you're writing really direct questions as to what their needs are, what their plans are, where are they headed for the next year or 18 months or whatever.
And maybe like a 5 to 7 minute presentation of
Yeah.
who they are and what they do. And the rest questions that we would have.
The presentation part's gonna be helpful because who they are and what they do will send us in certain directions just from that. But then you'll have more direct questions to ask them.
Counselor, was there a particular format for public input for the ARPA process?
For the ARPA process?
Yeah.
Yeah, we had, they had the application process, the guidelines.
But was there public listening sessions or anything that we did that we should be looking to structure?
They did have a couple of, go ahead, Scott, they did have a couple.
I don't know, this might seem silly. But in the name of saving time, we're going to compile a list of questions for agencies to answer. Would it not be easier just to send them those questions and have them send us the answers? And then, they do presentations when they make requests for proposal?
There's time to do that. That's a good idea.
You want to make that an agenda item
For next meeting.
for
Yeah,
next
bring your
meeting?
questions
Yep.
for the next meeting. And then they'll be sent out with the invites.
But just to echo the other concern too, is there a place that we can publicly post that or put it out there for anybody who wants it, so we're not being selective about who gets the questions?
Yeah, I think for sure there are. I also think that we'll have to leverage the collective knowledge of this group to make sure that all of the right people, because lots of times people aren't looking for a public notice if they know that something's happening, so. It would be unfortunate to miss someone that way.
I think the listening sessions that you were talking about for the ARPA was really more those that attended the committee meetings that we were talking about
Gotcha.
ARPA. We didn't necessarily set up like block meetings or anything. It was people that came that wanted to hopefully get a chance to speak or whatever.
And it's not a general open comment period. It's a,
Mhm.
there's some criteria for how you get to, and I think that's great, Scott. I think that putting that list out there, and putting those criteria out there first will help us to make sure that, like you said, that we have agencies that represent the work that we're trying to accomplish as opposed to community opinion.
Back a long time ago, maybe 2015, Counselor Hawes might remember this. There was the Community Health Leadership Board, which the city of Bangor led. The group was trying to get its hands around a solid understanding of opioid use in our community. And at that time, over the course of maybe six or eight different sessions, we invited people in to kind of educate the group. And then at the end of the process, the group made a set of recommendations. And a lot of those recommendations kind of ended up in the state opioid response plan. It was a lot of it was rational and logical and evidence-based. But I was just trying to, that the purpose of those sessions really was, that was 10 years ago. So we were in our infancy in working through this issue in our community at that time. And we've made a lot of great strides, and the landscape has changed also. And so I just think we need to be really clear about what the purpose of the presentations are. Is it to inform our RFP process? Is it to enhance an application? You know, why are we inviting people in to talk to us? And then I think the questions will flow out of that.
I think, thank you, Jamie, and I think bringing us back to our initial thought about Together Places, because we all had a concern about a community partner that we need, and so like, my initial thought was really about supporting the community in an emergency situation, and so, not that we can fulfill all of their needs, but is there a potential for us to help? I know that opens up the door, and maybe it may not be the road we want to go down, but I was just putting it out there for us to think about. We may not want to do it that way. We may want to have them come in as part of the larger process, so that we're not.
Oh, yeah,
Yeah,
because there's a lot of emergencies.
I know, it's, I don't think I'm in a good place to judge whose emergency is better and is more needy than another person, so.
So let me repeat to make sure I understand. Would it be prudent to just include Together Place along with the others? Now that we've sort of gotten to a place where we realize that there needs to be sort of a more expansive input process.
And I just do that, I'm not sold on sole sourcing some
Yeah.
assistance to one specific agency because there's some issues. But I hear the need and I hear the value, and I just want to make sure that we're not missing an opportunity. So
Yeah.
I'm a true Pisces in that way, swimming in both directions.
Well, right from the beginning, though, the committee said to be thinking about, or I think Chief Hathaway said it, think about programs that are already in existence that may need something that we could help with. So that would fall under that.
It is my understanding that it's not like just a need, it's like it will close if it does not get money, which I don't think is the case with other people, but I can't say that because I don't know. But it seems like it's a pretty unique and urgent need.
I think also I've heard the same thing, I have the same concerns. And like, I think there's a latitude in this, or in this body, this group, to be able to address emerging needs as we identify them. I think the HIV cluster is an emerging need that otherwise would be unaddressed without this funding in the case management that we talked about today. I do think the Together Place is an outlier in, you know, it also is an emerging need. And so I'm open to inviting them to come and talk to us, so we could have a conversation and then make a decision about maybe we want to extend some assistance to them outside of the RFP process. That's possible. I think it's up to the committee to decide, as long as it meets those tenets of allowable uses of the funding. I mean, that's the thing that we have to make sure. And then we could, you know, also be thinking about the RFP for, you know, the other chunk of the funding.
Yeah, and to echo what was said earlier too, I just think it's, if we're going to make a special consideration, we should have all of the information, which I feel like is why we were going to invite them. So we had all of the information to work towards whatever next decision happens, whether that's inside or outside the RFP.
Okay,
That feels great.
great. Anything else?
That's it.
I do want to say that I really,
I've got another meeting.
Hold on.
I just want to say that I'm really grateful to be part of this, and I'm really grateful for even having differing and dissenting opinions, how we were able to come together and collaborate to get some important work done. So thank you, everybody.
You all do great work. Thank you so much. And we will adjourn. Have a nice evening.